Hi there, my name is Claire Brooks and I'm the Volunteer Research Director of the World Dignity Project, a UK charity. And our mission is to fight for dignity and equality in mental health. Now, on World Happiness Day, why would we be thinking about dignity? Well, research has shown that dignity increases quality of life. That's happiness. And that's because dignity is about respect. It's about the respect that we have for one another as individuals and as equal human beings. When we feel respected, our self-respect is enhanced, and that contributes to strong mental health and happiness. Respect for human dignity confirms what Durkheim calls the sacred personality, the essence of who we are as an individual human being. Disrespect and loss of dignity attacks our sense of self. We feel alone, our mental health suffers, and so does our capacity for happiness. According to the United Nations Declaration of Human Rights, which was published just after the Second World War, human beings are equal in dignity and rights. And yet 80 years later, almost 80 years later, that is patently untrue, everywhere you look. Disrespect for the weak and the marginalised is evident. This violates the dignity of those whom we should protect and care for. So instead of finding happiness and joy in shared humanity, our own humanity is undermined. Fear of stigma prevents us from feeling comfortable about discussing our mental health, which makes us feel alone and undermines our self-confidence. Mental health has worsened during the pandemic, especially for people who already had poor mental health. In our workplaces, respect for employee mental health is a concern as we grapple with different working practices that affect people's health in different ways. Yet mental health attracts less than 2% of global health expenditure, less than 2%. And in many countries, all of the money is spent on institutions which fail to protect those who need our care and fail to promote their dignity. Everywhere, people with a mental health condition find it difficult to access healthcare services. And when they do find access, they have worse dignity experiences than those with a medical condition. These are all dignity issues. The World Dignity Project was founded in 2015 by a coalition of volunteers, and we're led by our president, Professor Gabriel Ibijara. And he was appalled as a trainee doctor, appalled and profoundly moved by what he saw as experiences of abuse, the abuse of the mentally ill. And he's a pioneer in campaigning for reducing stigma and promoting dignity in mental health. And we campaign on three fronts: trying to drive public awareness of the need for dignity for those with a mental health condition, supporting mental health care professionals with continuing professional development, and trying to influence policymakers and help them understand why dignity in mental health is so important and needs to be addressed. We try to bring together healthcare professionals, those with lived experience, and policymakers at conferences to encourage sharing of experiences and lessons learned. And we invite you to join us in June 2022 in London at the World Mental Health Congress, which is done in partnership with the World Federation for Mental Health. So you can go to our website, theworlddignityproject.org, or to the Congress website, wfmh2022.com. We've conducted numerous phases of research also to understand what makes for a dignity experience in mental health. Working with both healthcare professionals and service users to try and gain that difficult consensus. Patient dignity is well researched in medical areas, in geriatric care, in palliative care, but again, not in mental health, and we aim to fix that. We will shortly publish the first validated scale for dignity in mental health experience, and we will offer dignity skills training. We sponsor mental health champions. These are individuals, peer workers, grassroots organisations striving to promote dignity and respect in mental health. And at the conference in June, we will be awarding our mental health champions for this year and supporting and promoting their work. What are we most hopeful about? Well, we're most hopeful about starting a movement for dignity in mental health. We hope that you will join us. We hope that you will go to our website, join us at the conference, sign up for the newsletter, sign up to be a country representative, share your experiences on the website, and really help us take this movement for dignity, hope, and happiness to the next level. Thank you very much.